Hi, I'm Dr. Lindsey. I'm going to take you through a repair case that we did on a 26-year-old finer-haired young man who had had an unsuccessful FUE out of state a few years before. So let's go through a bunch of the issues that go with this guy, and some of them may apply to you. So this fellow had gone at age 22 to an FUE warehouse. They advertise all the time. All they do is FUE. Got big billboards, posters, online presence, and I've seen a couple of those. The billboards when I've driven up to New York, and the models in the billboards have such great hair. I mean, it would make anybody think about getting that procedure if anybody could get that result. Unfortunately, you, the potential customer, are constrained not by the money in your pocket, but rather by the quality and quantity of donor hair that you have on the back of your head with which you have to work. And so this young man has a family history of class 5 or 6 hair loss. He's tried medicines in the past without result and with side effects, so that's out. He doesn't want to wear a wig. SMP is probably not a great option for him with the hairstyle that he wants. And he's already wasted away some donor hair and certainly placed some scar tissue into the recipient area by doing this poorly the first time. So a great care of planning needs to be done and explained pre-op so that there aren't any misunderstandings, and that we can hopefully achieve the goal that he wants for the long term, which means a hairline that will age well, that he'll get enough coverage of the top of his head to make it worth doing, and for him to realize that no matter what, he's probably still going to have a bald spot. And that's a big pill to swallow. Some people would say it's not worth doing if you have a bald spot. Other people say that it is. But our goal is to work from the front as far as we can get, and it might take 2 cases. The next issue is he's studying to be a pilot. He just graduated from college. He wants to go to flight school, possibly in the military and possibly not, but he needs to have a short haircut. And so I suspect part of what talked him into doing an FUE before was the scarless surgery. As we all know, there's no such thing as scarless surgery. Anytime you make an incision in the skin, you'll get a scar. It's just managing that scar size and how much scar is placed that allows you to make hair transplants either acceptable or not acceptable. And there's a trade-off between 1 millimeter circular punch scars and a linear scar. And this needs to be really discussed with your surgeon before you start down this path. Because once you start down this path, you can't get off of it. And so there are things you can do if there are scar issues, but nothing's perfect. And so you should have these discussions before you start down this route. So he and I had those discussions and agreed that he's already had 1 failed FUE and he's got relatively fine hair. And so we're going to do 2 strip cases on him. And this is the first one of the 2 of the case. And on average, my strip scars, and you can see examples of those in most of my 480 or so YouTube videos, but my average strip scar tends to be as big as the black part of my eyeglass thing, which is about 1.1 millimeters. We get about 180 or so of those per year. And we get 10 a year that are skinny as this part, which is like a 0.5 millimeter, which you can really have a crew cut and not in seating. But only get 10 of those per year. And then I get about 7 scars a year that are 5-6 millimeters, maybe 7. And generally it's because of the way the person heals, because everybody gets sewn up the same way, but some people just heal differently than others. And to cover that scar, typically you would need hair about a 1/2 inch long, maybe 5/8 of an inch long. And so we had those discussions, and you should have those too. So we opted to do a strip case. Now next we need to design his hairline, and my son's 25, and so I see a lot of 25-year-old guys, and they've got this hairline like I had when I was 25, and so most younger guys want that hairline, but they fail to understand that at some point they're going to be 58 like me, or 78, and if you have a hairline down across here, you're going to look remarkable, and that might not be such a good thing. And so we want a hairline that will age well. And so I drew this hairline on this patient, and once we agreed, we lowered it a little bit, as you can see from the 2 lines. Once we agreed where it should be, we put a few irregularities So again, it doesn't look like a straight line. Nature is not full of straight lines. It's full of subtle curvatures and irregularities. And so we agree on this hairline, and we'll start from the front and go as far as we can get with the first case. Now note there are some hairs in there. Some of those are his native hairs. There's not a whole lot of those. And some of those are the FUEs that he paid for. I mean, he did pay for them. You can see them that are a little thicker than native hairs. There's no point in trying to kill those, but there's just not many hairs there. So perhaps even if we get 2 good cases out of him and he wants to do a little bit more, maybe we should save some hairs in case down the road he needs to tie those sides to the top. And so the key is to age-appropriate hairline, pack it with enough hairs as you can to make it look dense, subtle irregularities, and tie into the sides. So here we are taking out the strip. And this is a close-up. Now, hairs grow like trees. If you've come to the office or watched some of my videos, you'll see me working with plants and trees. And here in Virginia, the crepe myrtle flowering tree is everywhere. And it's my favorite tree. And so a one-haired graft, which looks like this, is kind of like this one-stalked crepe myrtle. They cover some, but not a whole lot. And a 2 or 3 or 4 hair graft, like this bigger crepe myrtle, covers more. And so when we do hair transplants, you put the one-haired grafts at the edge, and then just behind that you put grafts that have 2 hairs or maybe 3 hairs, and then back in the back you may have 4 hair, or back in the center you may have 4 hair grafts. Notice I'm not saying plugs like the 10 or 12 or 15 hair plugs of the 1990s, but hair grows like crepe myrtle trees or dandelions do in your yard. And so here's an example of what a couple of grafts look like, and they're just like little trees. There's a little bit of dermis surrounding the root, much like the soil in a pot of a seedling that you would buy at the nursery. And if you look at him, there are some spots in this strip that don't have any hair. Not a whole lot, but that's from his previous FUE. Notice that there's not many that are missing, so I think that a lot of the hairs that they potentially tried to take at the other clinic, they didn't get the root, and so the hair grew back, which they planted a hair without a root, and things just didn't grow. We see that fairly frequently from other practices that kind of dabble in FUE. And then this is not from this patient, but here's a cross-section of a scalp showing normal hairs and then some vacancies from where FUEs had been harvested in the past. So FUE definitely leaves scar tissue and definitely can deplete the finite amount of hair that you have to work with. So now the strip's out. It's a pretty nice strip. By comparison, here's a really dense strip. I mean, this is a thicker haired Middle Eastern fellow with just almost an infinite amount of hair. This is the perfect strip to work with. You can probably get 75 or 80% more hair from the same strip with this perfect strip. So back to this guy. So here we are in the front, and we're now about 9 o'clock in the morning. The patients arrived at 7, and the holes are already made, and now we're just waiting for hair to be extracted from the strip, and then we'll insert it. If you look carefully, the smaller holes are at the edge, and a little bit bigger holes. And there's not much bleeding with this. We insert the graft with a pair of forceps and a needle, and it's just like trees. So here's some trees I planted. You dig a hole and you put the tree in, it sits up a little bit, and then over the course of a while it sinks down. You of course take it out of the plastic bucket, so I don't need any comments telling me I forget to take that out of the buckets. However, it's the same thing. It takes a little while for your tree to go down, and the same is true with hair grafts. You'll see at the end, this end of case picture, the hairs that were put in first have already settled down, and the ones that were put in halfway through the case are up a little bit, and the ones that were last in are up a little bit, and they'll all be soaked down by the scalp and absorbed by the next day. And then we have patients generally come every day for 6 days. This fellow lived out of town and went home and did a pretty good job cleaning. Here he is at day 7. He had the stitches removed by the college nurse. And then what happens is hair grows for 3 weeks maybe, the hairs that he had there and our new hairs, and then they start to go into shock or rest cycle, just like tulips would in your front yard. The root's still there, they'll come back next year, but the hair falls out, and it's critical that the patient be made aware of this, otherwise they think they just got scammed for 10 or 12,000 bucks. And so the hair falls out, and then the pre-existing hairs that he'd paid for elsewhere, or his native hairs, will start growing back about 2 months and a week or so after the hair transplant. But the new stuff, generally, it doesn't really start to grow until 4 or 5 months on a virgin head, and this kid is a repaid patient, so there's some scar tissue. It usually takes a little longer. So he sent me this picture at about 6 months, I think 6 months to the date. And like a lot of people, well, did I waste my money? Did I have another bad hair transplant? And honestly, the doctor really never knows until it grows. I could just know on our track record, and that his case went very easy, and he didn't seem to do anything foolish in the first week. It's probably going to grow. And so, and he lives out of the area. Otherwise, I'd have told him that face to face, but I think we had a video chat about that. And then he emails me that he's graduating from college and he's moving back to northern western states to pursue his flight school interest, and he wanted to come see me before he went back. And so this is 10 months and 4 or 5 days from when we did it. And again, you just heard me say it takes about 13 months for a final result in a virgin case, and it can take 16 or 17 months in a repair case. So I actually didn't know what we were going to get, and he walked in and he looked like a completely different kid, or young man. No longer was he with his head down and kind of self-conscious. The guy walked in with a zest for life, and he really looked good. I couldn't tell he'd had a hair transplant, and I couldn't tell he needed any more growth, although statistically he's probably going to grow 30% more over the next couple of months. So this is him at 10 months and a couple of days after. And then here's his hairline. I think it'll get a little bit thicker over the next couple of months, but it looks unremarkable. Even if it doesn't change at all, it's an unremarkable and natural looking hairline, which is what you want. Yeah. And then here's the back of his head. He's got a very short haircut. And in fact, while I'm making this video, another fellow roughly my age just emailed in a picture. He's 3 months out from his hair transplant. He was an FUE repair as well that we did with the strip. Same exact scar, 3 months, covered with a relatively short haircut. And then here's a close-up of it. So in summary, we do lots of hair transplants. And prior to COVID, we did 80% of our business was repair hair transplants. And it's slowly starting to get back that now. And we're getting a lot of people that did foolish things with their hair during COVID. And so a couple of takeaway points for this. You have a finite amount of donor hair to work with. Even if you have an infinite amount of money, this is what you have to preserve. And so spend it frugally. Make sure you want to do this before you start. Make sure you do enough research so that you do it the best that you can. And make sure you plan for the future so that you don't sprinkle a little hair all over and then not have enough hair to have accomplished a goal. Most people are going to need to plan on a second case or a touch-up at some point, because even if it's a perfect hair transplant at age 30, you're going to lose a little bit more hair and you might need to tie things together. But the doctor can generally make an educated guess on that, but it's not a perfect guess. It's like, I'm looking out the window of our new office now. They said it's definitely going to rain today. It looks like it might rain, but it's an educated guess at best. And so save some hair for the future and don't deplete it all, and don't pack your donor area full of scar. Lastly, never rush into a hair transplant. There's no emergency cosmetic surgery. I've done about 4,000 facelifts and about 4,000 hair transplants. There's never a rush to do these things. You can think them through, particularly if you're a younger fellow such as this. Sleep on it a little while. Talk to your mom and your dad. Even if you're an adult, you can bring them to our office. You're less likely to get talked into something if you have somebody here with you. But there's plenty of ways you can educate yourself. There's not much of a reason for somebody to come in like a guy we saw yesterday who had just gotten a mailer. I don't know who does mailers anymore, for a hair transplant consult. Went in and had a hair transplant from a guy that's a dentist who just started doing hair transplants. I'm certain there are some oral surgeons that can do great hair transplants, but you got to think this through and do a little research and look at the track record of the person that you're going to. Well, I hope this was helpful. If we can help you, please give us a call. Thanks.